ago worked with Dr. Hilal many years ago as a foundation trainee or مقيم دوري بمستشفى ابن البيطار cardiac center surgery, and I learned a lot from his way of teaching and learning. So it's an honor for me to be here, actually, and it's good to hear from other colleagues. Yesterday, Dr. Sahar, Dr. Mohammed Al-Uzri, and other colleagues, and good to hear Dr. Nasaif was on the call as well. I hope he's still with us. So as Dr. Hilal said, I'm a forensic psychiatrist based in Oxford, and I'm also I do a lot of work with the Royal College of Physicians and education and training in different countries. I think you will be, feel free to interrupt and ask me questions. I can't see the chat window, but maybe Omnia, you can feel free to interrupt me and ask if there are any queries from anyone. Just I will start by some, maybe this poem, if many people will remember it, will know it. We are all here because of the roles of our teachers, our educators, in primary school, in secondary school, or parents, and medical schools, of course. If I'm a successful doctor today, it's largely due to my the role of my teachers and educators in different countries, in Iraq, in the UK, and wherever. So I'm really grateful for everyone. I graduated from this medical school, which probably some people will know. This is an Nahrain Medical School, used to be called Saddam College of Medicine in the past. And maybe it's one of the, I think it's probably at the time, it was one of the best medical schools in terms of education and training, the number of students, lots of focus on educators, on learners. And I'm really grateful to everyone who helped teach me and train me in this great medical school, which I hugely miss. I had the opportunity to visit it in 2018 and 2019, I think. I did a couple of lectures and sessions there. And because of, I think, the role of my educators, again, I had been humbled to, this is the Royal Society of Medicine, الجمعية الطبية الملكية بلندن. Thanks, alhamdulillah, and my name has been put on the wall of honor of the Royal Society of Medicine for my role in international education. I don't know, probably I can't see my name here. I was again honored because the first, I think one of the first Iraqi people whose name was on the wall was Dr. Qais Kubba, who is the famous obstetrician and gynecologist, and again our educator in medical school. And alhamdulillah, my name has been put here as a recognition of the role of everyone really in helping the education journey all over the world. I think we're all relying now on, a lot of education is happening across the online platforms because of the unstable political environment, and in many countries, this has affected the medical education and training, and we've been resorting to new and innovative ways of teaching and learning. As I said, I did still doing work with Iraq, with Lebanon, with the Oman, Palestine, and other countries, trying to teach and train people in psychiatry and also other specialties and communication skills, medical ethics, professionalism, and other issues, other concepts around that. So I think you've heard a lot in the last few days about learning. What's learning? It's a continuous process in which essential changes in the learner's behavior are brought due to experiences, be direct or indirect. It's a universal process. It involves change in behavior due to learning, and that's usually, ideally, should be a relatively permanent change in your behavior, your personality, your career. It's purposive, it has a purpose, and it's usually goal-directed, and encompasses resetting experiences or resetting of experiences. You start the session or the course with one thing, and you end up the course with a different thing or with different concept, different understanding. It's a product of activity and circumstances, And the good thing about learning, and that's why we say I teach the students I was taught by my teachers, is transferable from one generation to the other, transferable from one situation to the other. And it brings the intended change in behavior. I hope this is all making sense. I mean, I think when I'm a bit excited, I can speak fast. So إذا مستعجل قولوا لي, I can slow down. But I know it's the end of the evening for you. But I would like everyone really to focus and try and contribute actively if they can. Good. So active learning is one in which interactive methods are used, which improve learning by allowing the learners to participate in the process. We heard earlier from Dr. Mohammed Al-Uzri, who's also a good friend and a psychiatrist in Leicester, that interactive sessions, interactive clinical sessions, or theoretical problem-based learning or theoretical sessions, it helps you understand, and especially in medical education, it's problem-based solving or problem-based learning. You have a clinical situation, you have chest pain, or you have whatever abdominal pain, and you have to understand the reasons why this person is having a chest pain. There are 12 reasons for a chest pain, or 12 causes, medical causes or surgical causes. The same applies to abdominal pain, for example. So you can't simply memorize, okay, it's chest pain is pneumonia or myocardial infarction or muscular or stress or anxiety. You have to understand the process behind each pathology so that you understand how you can diagnose and how you can treat it. Again, this is something I'm probably blessed with, or many people are, especially people. I mean, the education system in Iraq is one of the best in the world. I see people from different countries here in the UK. Oxford is a multinational, multicultural city. You see people from Japan, from America, from England, from China, India, from the Middle East. I think we are blessed in Iraq to have great educators to help you understand the basics of learning and basic of medicine, and apply this in clinical practice. And I'm sure you know that Iraqi doctors all over the world, they are one of the best doctors and medical professionals in all specialties. On the contrary, Derek, our memorization, I think Dr. Sahar was warning us yesterday, stay away from memorization. It helps in the extrinsic or in the superficial learning or the passive learning, when you just need to go and do the exam. Or maybe if I was doing the MCQs for my memberships years ago, I had to memorize, yes, who invented the term psychiatry, or who invented the term, I can't remember, schizophrenia, for example. So you have to use passive learning sometimes, but it's just for the principle of the exam passing at this stage, not for permanent change in your clinical behavior. So as you know, so this is the simple diagram, or a simple hierarchy, or a pyramid of the passive and the active learning process. So if you look at the top of the red one, the ahmar, 5% comes from the lecture. 5% of the learning comes from the lecture. I think I share Mohammed Al-Uzri's biochemistry experience. The only exam which I had to redo in medical school was biochemistry, and then I think there was a lot of emphasis on focus on basics. I'm saying that my late father was a professor of chemistry, so I shouldn't have any but I think the way probably we were taught in medical school, or maybe this principle itself, didn't help us like that topic or that subject at the time. So 5% it comes from lecture, 10% comes from your reading and preparation around the topic, 20% comes from audiovisual aids, whether it's recorded, whether it's a video, and this is all passive learning. We're still with the passive learning. About 30% of it is demonstrations, whether it's posters or pictures or anything. And the majority of it, so if we count al-ahmar, 5, 15, 30, 65% is all base passive. Only 65% of the process. Whereas discussions or clinical discussion around the topic can give you more than 50% understanding of the topic. Practice doing. If you do a role play, if you do something like that, active presentation, it's 75%. And teaching others is definitely the most, the higher value or the higher level of teaching others, of active learning, if that makes sense. So as we say, yeah, teaching others, analyzing the topic, discussing it with other people always helps. Again, a very simple, I'm trying to keep my presentation, I think, short and sweet, as they say. Active versus passive learning. So if you look at the active, it connects the learning to the world, or it connects learning to the world, to external world. Passive learning is isolate the learning from other life experiences outside school. And this applies to all stages of learning and all of, I mean, from primary to secondary schools and also to universities. In the active process, the learner will accept the responsibility for the learning. Sometimes in the passive, if you look at the right side, avoid the responsibility for learning. You just read the book, or just maybe in the passive learning, you just memorize the paragraph or the number, the figure, and that's it. With active learning, you explore, you ask questions, you answer questions, you reflect on the information. I mean, we say, as we know that, for example, in the most royal colleges will have the curricula, there is an active learning concept, or lifelong learning. We always learn. I learned something new maybe in the last 3-4 days about different things, because I always ask myself, I always reflect. My patients ask me, or my colleagues will ask me to reflect or think about reflecting about different things. Reflection is a very good again, way of learning. And there are lots of presentations and discussions and types of reflection and how that impacts on learning. I think there was one example, we call it learning by listening. So you listen and you reflect while you're listening to the presenter, or you're listening to the clinical scenario, or listening to a specific scenario, and you learn new information about it. If you go to the right side of the table, passive learning is a passive zombie-like acceptance of information. You accept the figure. You accept 90% of people, for example, of anything will have. You have this 90% figure, or 10% people of people with psychosis will have a single episode of psychosis, or will have a treatment-resistant illness. So we accept that, but maybe sometimes we don't challenge ourselves and how we reduce or improve or modify the number or the figure. If you look at the active learning, and we will come to that shortly, we have strong intrinsic motivators, and I will speak about it. I don't want to say lots of details here, but yeah, you have the internal motivation to do better and to be a better doctor. In the passive learning, you're externally motivated. The external thing is the exam. You have exam next week, you want to pass the exam, that's it. You memorize the figures, the tables, the numbers, and that's it, you go ahead. In the active learning on the left, you engage your intellect, you engage your mind in active learning process, whereas in the passive, it hides or denies the intellect in a way. It prepares you for class, the active learning. And if you come prepared to the classroom, you will understand what's happening, or you will feel actually more comfortable if you're doing a presentation in front of your colleagues. And I will come to that later in the day about, yeah, you feel that you are on the moon, happy with what you achieved. Whereas with passive learning, you just come to class unprepared, and that will affect your motivation to learn, of course. With the active process, you're open-minded, you're interested in ideas, With the passive learning, you are closed-minded and intolerant maybe of new ideas because you have figures and you have to know them and remember them. Any questions so far from anyone?
No.
No? Nothing?
Nothing.
Oh, okay, good. Yeah, I think we talked about this earlier. So the active learning, or the passive learning, yeah, so it's only 10% of what people read, 20% of what they hear, and 30% of what they see. Whereas with the active learning of 90% of what they do, if you practice as a medical professional, you will, so 90% of what you do is active learning. Like you've treated this illness before, you know the bedside diagnosis. This is, I don't know, heart failure. This is renal failure. You see the renal face, the person with renal failure, you know this person has a renal problem, for example, because of you engaged yourself in reflection and learning about how a patient with renal failure will look like. The same applies to a gasping or a shortness of breath patient. Could be asthmatic with wheezes, or could be somebody with heart failure. And that comes back to your active learning and your days in medical school and days as a foundation or a junior doctor. And you analyze, you evaluate, you create, and you diagnose and give the treatment plan. So this is active learning, and this is the green one. This is the most permanent learning if you can sustain your interest, your motivation to learn and continue the process of lifelong learning. So traditionally, yeah, as we said, active learning activates the higher order thinking. Passive learning is only help the student to retain certain information. With the active learning, students have to have strong observation, communication, and critical thinking skills, thinking about all the possible scenarios. As we said, we gave the example of chest pain or abdominal pain, and you have to remember critical thinking. Yes, why this person could have a myocardial infarction, or a lady with abdominal pain could be pregnancy or ovarian, twisted ovary, or something else, or simply a psychosomatic manifestation of stress. So it comes to motivation. I mean, there are two types of motivation: intrinsic, extrinsic, and intrinsic. The intrinsic هو الداخلي أو المحفز الداخلي. الاكسترينسيك هو الخارجي. There are lots of studies where students were asked, why do you learn? So why you go to university? I think the answer will be different in different countries. So we all went to universities because we wanted to be good doctors or good lawyers or good engineers or teachers. In many other countries, people go to university again for different reasons. Some people will say they stop the gap. So I don't want a gap between my secondary school and employment. So just stop the gap, and then I will think about what life will bring, or what challenges I will have. So this is maybe like extrinsic motivation. If you just stop the gap, you're not interested in learning. The best thing is intrinsic motivation, when you want to be a good, successful medical professional. And we're all physicians here, or all doctors. So we all hopefully came to medical school with the motivation that we want to be successful in our lives. So motivation in learning and behavior is well researched in lots of education. It's also probably less in medical education. Motivation is an independent variable, and it affects the learning and the study behavior. It also affects the academic performance, the choice of medicine, and the specialty of medicine within medicine, and the intention to continue medical study. As I said, so you have the motivation to study, you have the motivation to be a good medical professional, and that's what will help you expand your horizons as a doctor, and also help the new generation of trainees, of students, of learners. And of course, I mean, the main thing is that we think about our patients. Our patients should be the focus of all of this. Lots of studies suggest that good professionals or happy doctors produce better or have happier patients. So there are, when we do studies here about patient outcomes, patients are happier when they have better doctors, when they have safer doctors, and they have well-led and well-mentored doctors. That will always result in better patient outcomes. Motivation could be affected by different factors, as we said: age, gender, ethnicity, socioeconomic status, personality, year of medical education and medical curriculum, and teacher and peer support. مثل ما قلنا المنtoring, support you get from your teachers, from your educators, ethnicity, gender, where you come from and where do you live. Sorry, in different countries or different students will have different perspectives about education and training. Motivation is also affected by factors that can be influenced, like autonomy, competence, relatedness, which have been described in the basic psychological needs, are important for intrinsic motivation. So relatedness, for example, or autonomy. I mean, you want to be seen as an autonomous medical professional or autonomous person who could diagnose and he could treat illnesses. So you become more indulged or more يعني تحط نفسك أكثر you put yourself in a more autonomous position to diagnose and treat illnesses. It's also related. So the more يعني مثل ما نقول العلاقة طردية, the more motivation you have, intrinsic motivation, the more autonomous you become, the more independent you become as a doctor, and also the more competent you become as a medical professional. And you are related, the relatedness, you seem or you feel related to this specific topic or this specific patient or illness. I mean, it depends on of course, your specialty. As a physician, you think that you seem related. That I'm sure many doctors will have a specific topic or special interest that they like. For example, in my specialty, I feel related to bipolar illness for different reasons. I mean, I think I'm good in treating and diagnosing people with this illness, and I'm sure this will apply to other people with different specialties like heart failure or diabetes. We have a special interest, we have special skills in treating and managing this illness. So it improves your autonomy, your competence, and relatedness to the topic. And these are the basic needs, psychological needs of intrinsic motivation. It is an intrinsic psychological factor. مثل ما قلنا, so you could come to your topic. I'm sure you've seen students who are جاي من ورا خشمة للمحاضرة يعني. I was in the emergency department a few days ago, and I saw a junior doctor who seemed probably not very interested in the topic. يعني جاي بس حتى يقضي الخفارة. He wasn't very interested in the topic or in the work. So you could put them on the left side of the picture على left. Motivated. They are not motivated. They are probably driven by external motivation. أنا جاي حتى أخذ الراتب نهاية الشهر أو حتى أخذ the box إنه I want to finish the course and that's it. I'm not interested in this, which is not, I mean, مو عيب إنه خلاص إنه he's not interested in this. I'm not saying what's my least favorite topic, but in medicine, I'm not saying it. Whereas intrinsic motivation, people are most autonomous. They are very motivated on the other side of the equation. And you can see the extrinsic motivation here. People might feel that they might be introjected. They might be less autonomous. They are under external regulation, under external control, so controlled by things like how much will I get at the end of this month, or how would I, finish this course of a month or 2 months and I progress to the next thing, which doesn't help a lot in learning about that topic or understanding يعني مثل ما قلنا هذا جاي من ورا خشم المحاضرة externally motivated extrinsically بس اللي يقضي وقته stop the gap and that's it. Unlike someone who is very interested, intrinsic motivation, they are the most autonomous, most competent students, learners, and definitely medical professionals in the future. واضح هذا السلايد؟
Yes, no questions so far.
Good. So as we say, I think I mentioned this earlier, autonomy, competence, and relatedness. احنا هو يعني our volition, our motivation هو the need for autonomy or self-determination is related to the feeling of volition, الإرادة in one's actions. أعتقد واضح هذا الشيء. And motivation is one of the most important factors affecting human behavior. في دكتور محمد تطرق بالمحاضرة السابقة. If you like something, like, I don't know, swimming or something else, why do you like it? Because it gives you praise or you get good feedback. You are motivated to do this topic or motivated to engage in this behavior, which helps you and other people in doing better. So intrinsic motivation triggers and sustains the interest of the open and the distance education students when it comes to learning on their own learning environments or e-learning environments. With the COVID pandemic, it was a challenge relying on the online tutorials, online meetings, online consultations sometimes. So you have to build up your intrinsic motivation to keep your learning process ongoing. So this is something that I do. I mean, I'll give you some brief examples about active learning and how we can do it or how you can do it. So this is one of the new ways of active learning or new educational systems. I'm sure you've had this before or you heard about it, student learning or student-led or learner-led learning. So 80-20. Does anyone know 80-20? What does it mean? I will answer it if there are no answers on here.
So no answers?
No answers. So 80-20, like I will have a group of, let's say, 3 medical students. I mean, in Oxford University, we have 2 students or 1 coming to do the placement for 4 weeks or 8 weeks. So I will have them for the duration of the 4 weeks, let's say. We will meet today for the introductory lecture, for example, and I will say next week, the X, Y, and Z, the student number 1, go and prepare how to diagnose psychosis or how to diagnose schizophrenia. Student number 2, how you treat depression, for example. So 80% of the work is done by the learner. So they will come next week, they prepared, they did slides, they read a lot about the topic, and they will present to me and the other colleagues in the clinical team or in the classroom, or maybe with the three other students in the group. Whereas 20% of the work is only done by me. So actually أنا مرتاح. هم اللي حيسوون الشغل. I listen to their topic, their presentation, and I provide the expert input. When they need an intervention from the specialist, I will tell them, okay, maybe you can do this in a better way, or this is right, this is wrong, something like this. So 80% is done by the learner, 20 is done by the educator. So 20 is the expert input. So this is one of the examples of active learning, one of the most powerful ones, that you ask the trainee or the student to do their job, to prepare in advance for the lecture or the presentation. So let's go back to that. So a few years ago or some years ago, I did a diploma in higher education in Oxford University, and we were taught by a very good educationalist, who is Kathleen Quinlan. I should give her praise. An American educationalist, I think psychologist by background. So my theory or my thesis was around transformative learning. So transformative learning, I did a little experiment or a little interview with a number of medical students I was teaching or supervising at the time. And we asked them about their experiences. So when they come to do the psychiatry placement for 8 weeks, we asked about their experience. So we did the interview at the end of the psychiatry placement. And I asked them about their experiences before and after the placement. How did they feel before? How did they feel after the experience? And that's the basis of what we call it transformative learning. يعني التحول ان انت التعلم مالتك متحول is the expansion of conscious.
So excuse me, Dr. Hassanin,
Yeah.
before you go to the transformative learning, there is a question for you about the 80-20 rule.
Yeah.
So is it applied to clinical or practical learning or only for theory?
Only for theory, both. I think both, it applies to both. If that answers the question. I mean, the simple example is basic or theory, like, yeah, you go and practice, or not, you go and prepare this topic, and you come back and you've read the research and you've read the books and you presented a nice 2 or 3 or 4 slides about this. It will help you improve your theoretical skills about the illness and also, I mean, clinical skills as well. Does that make sense? Same with the clinical. So like when you ask your trainee or your student to take a history from your patient, and I have to, one of my first educators, Dr. Fathi Mubarak, Dr. Hilal, maybe he will remember him, one of the famous educationalists and physicians in Iraq. He was asked, or I think he did this with us in the 4th year. علمنا شلون ناخذ history من المريض, we asked about every single detail in his life, which was very comprehensive. And that was, yes, it was a student learner led, because we did the history taking وتعلمنا واحد من الثاني يعني. So it could apply to both medical, clinical, and also basic and theoretical knowledge.
Okay, thank you so much.
Thanks. So مثل ما قلنا, transformative learning, you come to the topic with a certain perspective, you leave the topic or you leave the placement with a different perspective. It involved the expansion of your consciousness, of your knowledge, of your reflection about the topic. أعطيكم مثال بسيط إنه مثلا the student, one of the students came, he did a PhD in something. So we had what we call them graduate students, يعني هم يخلصون بعض الدرجات أو يعني university degree in chemistry or physics or something, and then they do medicine. So one of them actually had a PhD, and he said, I came to psychiatry with the notion, okay, people are all mentally disturbed, they're all very unwell, I'm frightened for my safety. That was قبل ما يبدي الدرس يعني أو الكورس. يقول بعد ما خلص 8 weeks, I felt different. I said, these people could be my neighbor, could be my family members, could be my friends. I've developed a lot of skills around history taking and now learning from people, learning from stories, and how this will impact on my skills. فنفس الشيء يمكن من sorry, when I started working in this field in psychiatry or forensic psychiatry, I said هذا يعني شيء يخوف إنه forensic, they all have mental health conditions and criminal behaviors. Well, actually, no. They have all been, for example, victims of abuse or neglect in their childhood, and they have offended, and we give them a second chance, we treat them and try and help them to become better and successful members in the community. فهو اللي بالعربي يعني التعليم التحولي أو transform your preconceived ideas from one thing, or maybe from negative to more positive, to make it in a very simple way. Social and emotional learning, again, it's one of the integral parts of human development. It's the process where young people and adults acquire to apply the knowledge and skills and try to link them to an emotional experience. You will all know, I think we all remember that we had positive and negative learning experiences. But if you reflect and if you think about the most powerful learning examples which was linked to emotions, where emotions were involved, like خايف من الأستاذ أو خايف من الquiz or something, this is something that will stick in your mind maybe for the rest of your life. I'm sure we can all relate to days from our medical school and previous undergraduate studies. The most powerful ones, or the most powerful learning experiences, were those who were linked with a strong emotional reaction. Again, I give the example of Dr. Qais Kubba, who was the obs and gynae educator in our time. He had a very special way of teaching us. كنا نخاف بالمحاضرة إنه أوكي كان يقول لنا مثلا خلصت المحاضرة أوكي طلعوا الأوراق هذا كويز. It was always a very powerful, I think, learning at the time, because it was linked to the fear of failing, or fear of not doing well in the exam, or not doing well in the quiz. And I'm sure we can always relate to similar or slightly different examples. And I think we can end shortly with another slide. Yeah, so these are some simple examples of active learning. Phenomenon-based learning. So you see a clinical scenario. Again, this is something I have to praise my surgical tutors in medical school. I still remember it when I did my 6-year medical examination. I did an examination of a hernia, an inguinal hernia, short case. And it's still stuck in my mind. Although I didn't do an actual hernia examination for many years. Last year, I'm a GMC examiner, so a lab 2 examiner as well. The GMC was trying to do new stations in the lab. So one of them we have يعني الممتحن يروح يطبق الحالات او الستيشنز الجديده كطالب، انه يشوف هل هي تشتغل هذه الستيشن بها تعديلات. فرحت سويت الانجوينال hernia. I passed the station actually. I haven't done it for many years. So because it stuck in my mind, ظلت ببالي من سويت الhernia examination. Again, praise to every surgical tutor, Dr. Hikmat Abdul Rasul, Allah yarhamah, or other people who taught me in surgery at the time. So phenomenon-based. If you remember how to do it, you will remember it for the rest of your life. Inquiry-based learning, of course, that you inquire, you ask, and you will learn. When I started my first day of my training here in Oxford, the clinical director at the time said, ask questions. If you don't ask, we will be worried about you. بعدين أنا فهمت إنه ليش إذا ما أسأل أسئلة معناها راح يعتبروك أنت you're not interested maybe. So asking questions will always augment the learning process. And discovery learning, مثل ما قلنا transformative learning, you discover new things. Every day is a new discovery for a new concept in life. And challenge-based learning, like problem-based. There is a challenging clinical scenario, what you learn from it and how you solve it. Role play is another one. It will help you reflect and learn. Debates, you have two opposing or more than two opposing views, you learn from from each other. So these are, keep them in mind, very good examples of active learning. So this is something we did a few years ago to Oxford and the OxPIC online medical education for people in Palestine and Iraq. We did a lot of theories and theoretical lectures, and also field trips. And we'll come to some, there were some tutor and student provided cases, and also some transformative learning cases at the time. And we did field trips in different countries. I'll end the presentation by sharing some pictures from different parts of the world, all in the Middle East. So this is الصورة هذه من الفندق in Jerusalem in القدس, where we did our a number of, I've been there 5 times to teach trainees and students, and I still have very good links with people there. This is in the only psychiatric hospital in Palestine with a number of good colleagues in Bethlehem Psychiatric Hospital. This is the medical education, or the International Psychiatry Conference in February 2017. This is a communication skills workshop facilitated by Dr. Saif and me. Dr. Saif was in the room here and other colleagues as well. This is in Lebanon, the American University of Beirut, where we did some training around forensic psychiatry and education as well. And I think this will conclude the presentation. So thank you very much for listening, and feel free to make contact if you have any queries.
Thank you so much, Dr. Hassanin. Very impressive presentation. So dear participants, if you have any question, any comment, please raise your hand and unmute yourself, or you can just write them in the chat box.
أمنية إذا تسمحي لي أنا عندي
Yes, please, Dr. Hilal.
شكرا جزيلا حسنين, an excellent, very informative. Really I enjoyed it. الفكرة من إقامة هاي الكورسات لأول مرة مثل ما تعرف حضرتك لطلاب الطبية وليس للأساتذة. تعرف إحنا سابقا أنا اشتغلت في طب بغداد من 2010 إلى طلعت دائما نسوي دورات للأساتذة للتعليم لنفس الثيوريز اللي حضراتكم تحكون بها الآن. ارتئينا نسوي هاي الكورسات للطلاب حتى يعرفون أهمية الميديكال إديوكيشن ويبدون يلتقطون المعلومات المهمة اللي ممكن تساعدهم في التعلم الصحيح، التعلم العميق، التعلم التفاعلي، واكتساب المهارات اللي احنا كنا سابقا ما نركز عليها. أنا آسف دا أتكلم بالعربي بس أريد الأمور توصل إلى أكبر عدد ممكن من الأودينس. بما ضمنها احنا سابقا بالكوريكولوم، وأتكلم عن طب بغداد اللي هي أكبر كلية وأعرق كلية في العراق، ما كان اكو موديولز كوميونيكيشن سكيلز، ماكو فد وحده واضحه وثابته للميديكال اثكس، ما كان اكو شيء كونسبت تعلم تفاعلي. طبعا هو يتبع النظام القديم اللي كان هو فلكسنيريا سيستم اللي هو separation between the basics and the clinical science. الان من هذه الكورس اللي نسويه تعرف اكو هوايه امور غير ايجابيه لتعلم الطلاب، وواحدة من هاي أو عدة عوامل غير إيجابية من ضمنها الانفايرمنت، الليرنينج انفايرمنت. مثل ما قالت أمنية قبل شوية it is the bad things to have a bad tutor for her at any time. قد يكون طريقة التقديم، قد تكون الكونتنت، قد يكون هو الطالب not interested in that part of the curriculum, in that part of the الماتيريال اللي يتعلمها. What is your advice for the student, for the undergraduate medical student, to make use of the very important point that you have said in a simple way? أنا أشوف دورات إحنا نشوف الوضع كله أسود وأظلم، وبالتالي نحاول نبقى في مكاننا ونقول إحنا ما نقدر نسوي شيء لأن الوضع هو أظلم. أنا أعتقد لا، دائما أكو فد هامش إن ممكن كطلاب كأساتذة كتدريسيين whatever we are، أقفد هامش إحنا نقدر نشتغل به ونقدر نبدع به as well، خصوصاً بالنسبة للطالب لأن مهمته الأساسية هو التعلم. نعم المستشفى مزدحمة، عدد طلاب هواية مثل ما قال دكتور نصيف قبل شوية، الظروف غير مواتية، كوفيد 19 اجت وسوت النوبة، حتى السيستم اللي هو راقي جدا مثل في بريطانيا بالتعليم أصبح يعاني بسبب الكوفيد وإلى آخره. فحسنين please what are your advice to the attendee of this session?
This is the $1 million question, Dr. Hilal.
أنت راح تعطينا جواهر.
Thank you. I think it's the answer is يعني السؤال أو الجواب خلينا نقول مو probably simple answer, but I think if the onus is on the student, is on the learner. الresponsibility المسؤولية هي علينا أو على الطالب نفسه كlearner. هو you should learn, you should push yourself. مثل ما نقول أنت يعني ادفع نفسك أو push yourself. I know the situation can be difficult. أنا ما جاي من المريخ، أنا عشت بالعراق وتخرجت بالعراق وعشت يعني اشتغلت في مستشفيات مزدحمة وذبيت طوارئ بأول 3 أشهر من الفاونديشن. فيعني it's not you can do it and you can be focus on your professional development. خلينا نقول as a doctor, be a better doctor in whatever specialty. be an humanistic، يعني خليك انت انسان قبل ما تكون اي شيء، انسان قبل تكون طبيب. وخلي يعني make the patient as your focus, because you're learning. I know we all want to be successful and rich and known and من هالشغلات، بس you should focus. We are treating human beings. We're not dealing with جماد. We're treating human beings. So your values should be this: respect for other professionals, respect for your patient, and learn. Life is a يعني ما استحي من I was doing an assessment yesterday, and one of the senior nurses said يعني جت قالت أنا توقعت there was a junior doctor here بس ما توقعتك أنت موجود. قلت لها I'm still learning. We always learn. يعني it's a life مثل ما قلنا، أنت يوميا تتعلم شيء جديد. Keep an interest in learning. Keep an interest in becoming a better person, a better doctor. Respect for each other. Respect your profession, and also respect your patients. أنا هاي يمكن الشغلات القليلة اللي أقدر أقولها. حب شغلك. اكو مثل معروف دائما يقولون انت هواي تسوي شغلات وتروح منها. If you love your job you don't need a holiday. اذا انت تحب شغلك انت you don't need a holiday. You are enjoying your time. You are enjoying yourself. Love your job. Be nice to people. Respect other people. I know there are challenges. I know مثل المحاضرة اللي سويناها بالكوفة، احد الزملاء قال احنا communication وشون وانا اسوي وعندي 60 مريض واقف بالباب مثلا. I know you should be nice. We have to be respectful and courteous to each other. And build yourself. Be a better doctor, because that will interact. Eventually, you will be a better person, and it will help others be better. I hope that answers the question. I see there are some questions on the chat window.
Thank you so much, Dr. Hassan. Dr. Nsayef is raising his hand. Dr. Nsayef, go ahead, please.
شكرا جزيلا. شكرا حسنين على البرزنتيشن الحلوه، وكان صار لنا فتره ما سامعين صوتك. سؤال يمكن يهمني يعني كتدريسي اكثر ما يهم الاخوان الطلاب يعني، بس بطريقه اخرى ربما دارك فيهم هم. انه احنا مرات ايش قد ما نحاول انه يعني we stimulate some students to be interactive. Some of them they don't. So what are the reasons يعني from your يعني very good experience, what are the reasons and how can we overcome this?
I think Dr. Saif, good to hear from you. طبعا we miss our nice days in Baghdad. Hopefully إن شاء الله قريبا يعني meet again. It's a problem everywhere. يعني حتى بأكسفورد we have a number of students rare يعني قليل إنه rarely هم they're not very interested. بس if you keep the focus on them, if you خلينا نقول مو تحرجه لكن إنه تحطه put them on the spot. يعني فلان روح حضر لنا فلان مادة مثلا الأسبوع الجاي، أو you put him in, give him an active role in teaching or an active role in learning. This is one of the things which could be يعني could work to improve their education or their motivation. Also check why they are. You could speak to them. So if someone is not interested or واحد مثلا يلغي هواية بالمحاضرة, why they are not interested or why they are not learning or they are not participating actively in the process. They could have they ما عنده واعز أو سترس أو something أو teaching method مثلا ما يحبها. It might not be difficult to tailor it for everyone, but try and get some ask the student why they are not participating, and also give them an active role in the process. مثلا الشغلات اللي يشوفوها انه تفيد give them small group teaching like 2 3 4 5 people وخلي كل واحد منهم يحضر شيء أو يقرأ paper ويجي يقدمها مثلا. It will work or it will make people do better. Sometimes the learning style is different. مثلا أنا يجوز عندي visual learning style أنا أشوف صورة وأحفظها مثلا أو يعني أتعلم منها. Someone who's maybe he could read and learn, somebody could listen and learn. So you could assess their learning style and see what's the best educational way or best learning way for that student, if that makes sense.
Thank you so much. Dr. Mustafa Haidar, go ahead please.
السلام عليكم جميعا. طبعا أول شيء أحب
السلام.
أشكر الدكتور هلال وبقية الدكاترة وكل الزملاء يعني على هذا التنظيم وهذا الدورات يعني الفشيرة. بس يعني بس مجرد يعني suggestion إنه يعني دكتور هلال بقية الزملاء هاي يعني بالنسبة للأعداد أنا بالنسبة أشوف الأعداد الطلاب خطية يعني قليل. فمن وجهة نظري أكو بيهم هواي طلاب مثلا عندهم هواي انترستد بهاي ككورسات وهاي بس احتمال ما يوصلهم مثلا يعني الإعلان أو سوالف هيك من هاي الأمور. فحبيت أكون سجستن مثلا خاصة دكتور هلال مثلا إذا يخلي مثلا شلون كل جامعة إنه يسوي كونكشن من الطلاب يقدر إنه يتبنى هذا كواحد أكتف إنه يقدر يوصل كل الإعلانات بالنسبة لبقية المراحل ووراها إن شاء الله بركة يعني اللي يريد يحب يحضر أو ما يحضر بس نسبة كلش كبيرة تحب تحضر.
ممكن أجاوب أمنية؟
والدكتور.
شكرا جزيلا دكتور مصطفى. احنا بودنا الكل تحضر والكل تستفاد وهي احنا اساسا مسويها هكذا. يعني انتم قدامكم 12 استاذ من خيرة الاساتذه من خارج العراق وداخل العراق، وانا اقدر جدا دكتور حسنين، دكتور محمد الازري، دكتوره سحر من وقتهم الثمين ويومهم. يعني اليوم عطله عندهم هم الويك اند مقدس في اليو كي واوتسايد ومخصص كل واحد منهم ساعتين. ان هذا في شيء وي ابريشيتد حقيقه الوت. لكن يا دكتور مصطفى اريد اقول لك فد شيء لازم نقوله، احنا كل ما نكون ترانسبيرنت نوصل للهدف باقصر الطرق. احنا عندنا هوايه ما اريد اقول هوايه، عدد لا باس به من الطلاب نوت انترستد، وحتى شفت هاي في كليه طب بغداد. يعني انت تتعب على الايفنت وتسوي الايفنت وتجلب the best who can do that event وتحاول هدفك انه هالثقافه الفلسفي مال المودرن ميديكال education تتعمم، وتقول للطالب ترى انت طبيب، ومثل ما قال دكتور حسنين الطبيب ليدر والطبيب مسؤوليه والطبيب انسان والطبيب قلب كبير والطبيب يتحمل والى اخره. يعني هو يفرق تماما عن اي شخص اخر، عن اي مهنه اخرى تفرق تماما حقيقه. ومع ذلك نلاحظ عزوف عدد كبير من الطلاب عن هاي الاكتيفيتي. هسه انا لا اتكلم عن طب بغداد لاني كنت بها مدير التعليم الطبي وكنت مسؤول المناهج بها وهوايه من الطلاب ما تشوفهم انترستد. مثل ما قال حسنين الموتيفيشن مالتهم اكسترنسك، الموتيفيشن مالته هو شلون ينجح فقط، حتى ما يهمه يكون طبيب، حتى ما يهمه يكون كواليتي دكتور، حتى ما يهمه يكون distinguished in his branch مهما كان نوع الاختصاص مالته. وهذه النقطة أثارها دكتور نصيف قبل شوية، هو عدم اهتمام الطلاب بالموضوع. احنا نحاول نخلق ليدر من عندكم، انتم اللي راح تقيدون المستقبل، انتم اللي راح تكونون على سكة صح. أقول لكم شيء صريح تماما، احنا ما حد سوانا هكذا في وقتنا، مو حسنين؟
صحيح.
قبلكم ما حد سوانا هكذا، ما حد قول لنا تعال ترى اكو شيء اسمه ميديكال اديوكيشن، ترى هذا ديسيبلين، ترى هذا مو كارديولوجي ولا سايكاتري ولا سيرجري، هذا ديسيبلين بحد ذاته علم. التعليم والتعلم علم، الاسسمنت علم، الكواليتي اشورنس والكواليتي امبروفمنت. لكن احنا دكتور مصطفى حتى اختصر ما اطول عليكم، موست ويلكم باي طالب من اي كليه من اي مرحله باي خريج من اي مكان باي استاذ. أنا قبل 10 سنين كل شيء ما أعرف عن التعليم الطبي، دخلت دورات ورحت وأجيت وتعلمت من حسنين، من محمد الأزري ومن نايجل باكس ومن من هواية أساتذة خارج وداخل العراق، وأصبحت أقول أعرف مبادئ التعليم الطبي. ولا يعني كلنا ما كنا نعرف، إحنا نريد حتى الأساتذة وهي دعوة صادقة لكل الأساتذة أنه يتعلمون مبادئ التعليم الطبي الحديث، طرائق التدريس الجديدة، شلون يوصلون المعلومة بطريقة أفضل للمتلقي، وكيف يقيمون الطالب تقييم صحيح. شكرا جزيلا. أنا خالد.
شكرا دكتور هلال. اكو سؤالين بس حبيت اجاوبهم قبل ما يخلص الوقت. دكتور ياسر عامر او عمار is a very emotional doctor good or bad in the future. تعتمد what very emotional means. يعني انه انت you should be emotional. انت you can't detract or detach yourself from people experiences, from people suffering. I think it's good to be emotional. It's good to be يعني مو انه تنهار وتبكي من تشوف اي مريض، لا طبعا، لكن تتاثر من تشوف المريض وتعتبره صديق او قريب او احد افراد عائلتك. احنا كنا معرضين يصير بينا مرض ونتعامل مع هذه الحالات. It's good to be emotional. I think it's good rather than bad. There was a question from Ari Ibrahim, how to overcome the difficulties of active learning during current pandemic. I think مثل ما قلنا انه مثل ما قال ايضا دكتور هلال دكتور نصيف والاساتذه السابقين، the active learning is an intrinsic process. انت you should build your skills, whether there is a pandemic, there is no pandemic, whether there is حصار او ماكو حصار. انت you should learn, you should read, you should watch videos, you should do role play, you should get a mentor, for example, somebody who's more experienced than you. If you're a medical student, get a mentor who's more experienced. Maybe إذا أنت صف سادس, get a mentor from someone who's a foundation or a مقيم دوري, or somebody who's higher than you in the medical hierarchy. You learn from him how to become a better doctor, how to become a better physician, how to do this or that in a specific way. So the COVID pandemic really shouldn't affect your intrinsic motivation to learn. Bushra or Bishara Chachman, which is more important, motivation or discipline? Discipline اللي قصدك بانضباط. I think motivation is directly linked to the learning process. So if you are motivated, you will learn better and you will have more sustainable effect in your personality and your clinical behavior. Discipline أكيد اللي هو discipline, يعني الانضباط, as if that was what you meant by your question. إنه good professional behavior. I mean, you can read, for example, I mean, something maybe we could again نود نسوي دعاية للجنرال medical council, but there are good medical practice guidelines. How to be truthful, how to be honest, how to be ethical, how to communicate with people, respect other people. So read these guidelines. This is the discipline of you as a doctor in the future.
Thank you so much, Dr. Hassanin, and thank you all for your contribution. Sorry if you still have questions because we are on time and we need to wrap up the session. So thank you for listening and thank you for attending. We have a feedback form and my colleague Bishara has sent it on the chat box.
I can't hear anything.
Omnia, are you still online? Omnia, you are muted.
Okay, so sorry. Just to a notice for the participants, we have a feedback form and my dear colleague Bishara has sent it and I have resent it again at the chat box. So kindly please do leave us your feedbacks on that form. And thank you so much for your attendance and listening. We will stop at this point because we are near the final exams, and we will resume our sessions with module 3 in mid-August. Thank you.
Thank you very much. Thank you.
Thank you very much, Hassanin. Very interesting. Sure. We enjoyed your presence, and this is the first time, but not the last one. You have to be prepared. بعد تورطت بعد الله شيء خلصك من عندنا.
ورطتي. تدلع دكتور انت والجميع.
شكرا جزيلا.
عفوا، شكرا جزيلا، مع السلامه.
حرامي بشاره للستاف اللي ادار ويانا. ايضا شكرا موصول للدكتور محمد الأزري السبيكر اللي كان قبلك، وان شاء الله نلتقي بعد منتصف اوغست من يخلصون الطلاب الامتحانات، لان احنا الكورس سويناه ديزاين كل اسبوعين ننطي موديول يمتد الى حد شهر العاشر، نكمل 6 موديول ان شاء الله. فشكرا للجميع ونشوفكم على خير.
شكرا جزيلا، مع السلامه.
شكرا جزيلا.
Good night.